Back, you can blame our sedentary lifestyles and high-fat diets for the high rate of gallbladder disease right here in this country. For instance, did you know that 1 in 5 adults will develop gallstones in their lifetime, and 20% of those will need to have the gallbladder removed? As Serese reports tonight, a doctor at Fremont Health is performing a new outpatient procedure to make that process a lot safer and a lot less painful.
For the last year and a half, Valerie Prinslow's stomach
Any pain when I'm pushing?
has been a real pain.
And I'd get stomach pains, and I'd like, maybe it's something I eat, I don't know.
A few months ago, that pain hit with a vengeance.
I could not move. I had my head hurt, my back hurt, my side hurt, and I was on the floor.
Dr. Jake Wiesen says Valerie's gallbladder needed to come out, and he had a new way to do it.
We're using a single incision to take the gallbladder out. So traditionally, the way gallbladders were removed, it was a large incision underneath the right rib cage. The problem with that is it's 3 to 4 days in the hospital. It's a very painful surgery. It's a large scar.
Another method is the laparoscopic procedure, but it requires 3 to 4 incisions. Now with the Vinci Surgical System,
We're using a single incision. It's a little under 1 inch long. It goes right through the belly button. So this is what goes through the incision in the belly button.
he performs the entire procedure while sitting at this console just feet away from the patient. As seen during this exercise, the robot's camera gives him a 3D high-definition look while he controls the surgical arms with his hands and feet.
To me, it means it's a little bit safer because all of our motions are very precise.
Now, you've probably never seen one before, but this is what a gallbladder looks like. Gallbladder removal surgery is actually one of the most common procedures done in the U.S., but Dr. Wiesen is actually the first in the metro to perform the single incision procedure.
Valerie was his first patient.
No pain up here where the gallbladder used to be.
Nope. I have no issues with my stomach at all anymore.
As for that scar,
It's just right here, this little red mark here.
I mean, there's barely anything. You can't tell I had surgery.
something doctors say is the biggest benefit of all. In Fremont, with photographer Dustin Dales, Serese, WOWT 6 News.
Valerie is not your typical gallbladder patient. She works out, she has a healthy diet, but she is a woman, which is a risk factor. Plus, she has a family history. To reduce your risk for gallbladder disease, Dr. Wiesen suggests a low-fat, high-fiber diet along with regular exercise. The good news here is we can live a perfectly healthy life with or without a gallbladder.